Now, today our topic is WHO checklist. WHO checklist, uh, who are working in the OT, they are very well familiar with this term WHO checklist. So, nowadays it is very common in all exams of the medical field regarding the WHO checklist. So, there is one checklist in the OT we are using commonly. So in WHO checklist, there are some component that we have to follow, like before the patient entering into the anesthesia and the during anesthesia and uh, before leaving the patient from OT. So there are some components that we have to read very careful, because in every exam there will be one question regarding the WHO checklist nowadays. So we all know why we are using the WHO checklist in OT, for the patient security as well as for the healthcare worker safety. So what are the component of the WHO checklist? WHO checklist having three component, like first is sign in, second is time out, एंड थर्ड इज साइन आउट. एग्ज़ाम में वो लोग कैसे पूछते हैं, जब वो लोग पूछेंगे व्हाट आर नॉट इंक्लूडिंग इन द WHO चेकलिस्ट, दे विल गिव फॉर ऑप्शन. The one option will be an incorrect, so we have to read very careful what is the component of WHO checklist and what we have to skip. Like sign in is the component of WHO checklist, time out and sign out. So if you remember this three component, then you just read sign in and sign out. These two will be there, sign in and sign out. And the one is time out, not time in. So actually sometime the people will give time in, so we will confuse in the sign in and the time in. So you have to be very careful regarding the sign in and time in. Time in is not included in the WHO checklist. So there are three components: sign in, time out and sign out. So what is in the sign in, time out and sign out? If we see the sign in, it is before induction of anesthesia. When patient shift to the OT, so after the OT shifting till the anesthesia induction period, whatever checklist that we have to follow, it will go into the sign in before induction of the anesthesia. Whereas in the sign time out, before skin incision, like before skin incision, whatever checklist that you will tick in the checklist or you will follow to ensure all the healthcare worker and for the patient safety, before skin incision whatever steps you will take, that is time out. And after the procedure or after the surgery, sign out बिफोर पेशेंट लिविंग ऑपरेशन रूम से लीव करने से पहले पेशेंट का जितना भी चेकलिस्ट हम लोग फॉलो करेंगे, असेस करेंगे, दैट इज़ इंक्लूडिंग इन द साइन आउट. सो दीज आर द थ्री कॉम्पोनेंट ऑफ द WHO चेकलिस्ट: साइन इन, टाइम आउट एंड साइन आउट. So what are the question in the exam regarding the WHO checklist? They will ask what is not included in the WHO checklist. So they will give for option like sign in, time out, sign out and time in. So we have to skip one option. So what option will you skip? For example, like this: what is not in the WHO checklist? Sign in, okay, we had seen sign in was there. Time out, yeah, time out was there also. Sign out, yes, it was also there. And last is time in. No time in option in the WHO checklist. So this is the wrong, time in. So like this you have to read very careful each topic and how the question can be from that topic. Thank you.